Now we get to talk about another type of mode of treatment for asthma. Alright, so this is what is known as a dry powder inhaler. Okay, and how the dry powder inhaler can actually be used for the treatment of asthma. Okay, so what is a dry powder? Dry powder is more of like the drug is in a powder form, so I put this in a container, and the container is in a way that the patient can be able to fix their mouth, then inhale the powder. So where is the powder going? The powder is of course going directly into the respiratory system, going into the lungs, and of course the lungs is basically the primary site of what the disease of asthma. Do you understand? So it goes directly into there, and it basically gets to act faster, So a dry powder inhaler, just so you know, is a device used in asthma treatment, and it delivers medication directly to the lungs being the primary site where the disease of asthma is occurring. Okay, so it's breath activated, meaning the patient inhales deeply to disperse the powder, making it very effective, portable, and also what propellant free. Okay, so if the drugs get into the lungs, the effect is just within the lungs, reducing adverse effects in the rest of the body. Okay, so how these dry powders work? It's just a thing, right? The drug in it is just still the normal asthma drugs we have, just that the asthma drug is coming in a different form. So drugs like corticosteroids, or those Budesonide, Fluticasone, the bronchodilators like the Salmeterol can all be put there. So no button press. The patient's dips. Okay, fast inhalation is what disperses the powder. It's not like other inhalers that you have to now press some 1 or 2 button. Do you understand? So it provides direct action at the site of the asthma, okay, which is the lungs, the airways. So benefits of this is actually propellant free. There's ease of use, it's portable and convenient. There's effective drug delivery. So limitations and risks: require strong inhalation. So if the patient is so weak, sometimes asthma patients are so weak they can't even breathe so much, so that the patient will not be able to take it. Do you understand? So such patients, you just have to put them on nebulizers. So humidity sensitivity and training is needed. You have to now train the patient on how to breathe better for the drug to go about better and all of that. So examples, we have the Turbuhalers, we have the Diskus, we have the HandiHalers, we have the Respiclick. All of them, don't worry about them. We'll get to discuss about their pharmacologies.